Hi everyone, thanks for watching this video. I'm going to go over borderline personality disorder and narcissistic personality disorder and how they're comorbid when somebody has both of them, which is maybe more common than you think. Most of you guys are watching this video because you've had people in your life with these disorders and you're trying to understand them. You're trying to understand their mental illness to better understand their behaviors and your relationships, stuff like this. And I hope that people with these disorders that watch this video can benefit from this as well. Personality disorders, mental health conditions where people have a lifelong pattern of problems. That's what makes it disorders, when our problems cause such negative effects and patterns in our life. They have problems with how they see themselves, reacting in social situations, their interpersonal relationships, understanding their own emotions, dealing with stress, impulsivity, problems with their work, home life, living situations, their overall quality of life. They're in the cluster B, these two. And the cluster B is considered wild for a reason. They're very commonly exploitative. And that's why you guys are watching this, huh? Maybe you were abused, traumatized. Borderline, also known as, or commonly known as now, emotionally unstable personality disorder, but I will refer to it as borderline still, has emotional instability, a fear of abandonment, and intense relationships. Narcissistic personality disorder deals with grandiosity, entitlement, lack of empathy, constant need for adoration, admiration. These overlap in these personality disorders. And let me be clear first that personality disorders has a ton of overlap. Tons. When you cross the line, if there's 10 of them, when you cross that line, you're going to have different traits of different disorders not necessarily meet the criteria for the diagnosis. BPD and NPD have intense emotional responses when they're comorbid. This is very common. Very intense emotional responses, difficulty in relationships, exploitative. Unique challenges of having both is fluctuating your self-esteem, complex interpersonal dynamics, dealing with the self. Very serious mental illness. Distinct diagnostic criteria for both disorders. Both. 5 out of 9 diagnostic traits for borderline and also 5 out of 9 for narcissistic. Twice as nice when you have both. 10. You have at least 10 diagnostic traits. 40% of people diagnosed with borderline personality disorder also have narcissistic personality disorder. The comorbidity can complicate diagnosis and treatment as the overlapping traits intensifies the symptoms. Twice as nice. 1. Increased instability. When you have both, you may experience heightened emotional instability, and it can manifest as intense mood swings, impulsive behaviors, difficulty managing stress. Both these disorders very much fill up the group of HCPT, high conflict personality type. Very much, these two. Wow, a lot, most. High conflict personality type with people, lots of conflict, yeah. They may have temper tantrums and rage, addictions, risky sexual behaviors, impulsivity, relationships, home, job. Many of you may think or wonder if someone that has these disorders may be a sociopath. Number 2, higher risk of self-harm and taking their own life, something that's common with both these disorders, extremely high risk for self-inflicted death. Increased risk of self-harm, things like cutting themselves, taking their own life behaviors, Overlapping traits and impulsivity, emotional dysregulation, massive, is what can make this worse. Emotional blackmail is common if you have relationships with someone like this. If you don't do this, I will take my life. If you leave me, I'll take my life. If you don't stop talking to her, I'll take my life. Number 3, if you go to work, I'll take my life. Number 3, complex interpersonal relationships. Oh. The borderline narcissist struggles with maintaining stable relationships, with their need for validation, fear of abandonment, lacking empathy, can create challenging dynamics with others. Triangulation. Seems like a lack of commitment, specifically with males. Forcing commitment, maybe more specific to females. Marry me. Marry me now. Marry me now. Let's get married. Number 4, greater mental health challenges. Comorbidity can complicate diagnosis treatment as overlapping symptoms intensifies overall severity. Yeah, I read it again. Things like anxiety disorders, depression disorders, clinical depression, things like this, delusional disorders, dissociative disorders, bipolar, eating and addiction disorders, and many other mental health disorders. Number 5, protective factors. This is a very interesting one. I don't know if you guys are aware of this. It makes perfect sense. Some studies suggest that narcissistic traits in borderlines act as a protective factor. We know that narcissists suffer from insecurities, fears of vulnerability and inadequacies, and they will overcompensate or protect themselves with their ego, their inflated ego. That's what the inflated ego is for. I'm not capable, but I'll sure act like it. I'm not good enough, but I'll be better than everyone. It's kind of like having low self-esteem in what we usually want if we have or suffer from low self-esteem is we just want to be equal. We want to be better than everybody else, where they have to be, or we want to be the same, equal, different but equal, but they got to go higher. They got to go higher. They got to elevate themselves, knock you down. Very, very interesting. People with both these disorders range in personality. They can be pretty nasty. A haughty attitude. I'm so good and snobby, judgmental, grandiose, entitled, conflict all the time, very angry, very seeking revenge, Machiavellianistic, plotting. Like I said, could look like sociopath, very controlling, isolating you, doing everything for. I'll see this very nasty, haughty, angry, snobby, controlling, conflicting, revengeful kind of attitude person. You would think more of a male, but I've seen it in females. Or you'll have like this very victim, covert, insecure, take care of me, marry me, I'm going to isolate you and totally control everything you do and make every single thing about me constantly. That's what I'll see. There's somebody on YouTube, I've watched a couple videos of his, and he seems to be pretty candid. If you're interested, go check him out. He is diagnosed with both. The borderline narcissist, borderline personality disorder, narcissistic personality disorder. He's on YouTube and Facebook. Goes by the name The Bat Wolf. That's it, 3 words. The Bat Wolf. If you want to check him out, go check him out. Be nice. Be respectful, please. Treatment. Talk therapy, psychotherapy, medication, support groups, dialectical behavioral therapy, cognitive behavioral therapy. No matter what will help. No matter what. Probably help anyone. Everyone. If you find yourself in a relationship like this, step outside, tell someone, and ask for help, okay? I'd appreciate your guys' examples. Some of the behaviors and traits and symptoms that I've listed. Do you suffer from this? Do you know someone who does? Did you know someone who does? Did you have a relationship with someone who does? I'd be very interested to hear about it, and so would a lot of other people watching this video. Really appreciate your examples, stuff like this. Questions I'll answer. Appreciate thumbs up, subscribe to the channel, share the video if you find it beneficial. No matter what, everyone, all of you, please love yourself first. Thanks. Bye-bye.